The reason we play University of Texas fight song right now is not really for me. It's for our doctor who happens to be in the house right now. Every Wednesday right about this time, we have the Altus Health Update. Altus, choose well. You have to choose Altus, a wonderful association with the doctors, facilities all over the whole city. So we have a doctor calling in or sitting in and with us today. I like this subject today. Dr. Jeff Cannella is with me. UT graduate. Let's start with that. Horns up, my brother.
Hook 'em.
Our fight song, it's not ranked higher than LSU
No,
or Michigan or Notre Dame. This is bad.
It is bad.
I know. Called the loss because he may have about 2 more days on the clock before he's gone. So we'll talk about that another time. You have a lot to do with pain management, pain medicine. You're just the guy I want to talk to. So, Doc, I woke up this morning, my shoulder hurts. Because you haven't heard that one at parties and like that. As I get older, as I'm working out and running more, man, why am I in pain? And how the hell do I make me feel better?
Well, people experience these kind of things if they exercise too much, or occasionally, like you may be the weekend warrior, and you just kind of pay the price for that.
I'm a weekday warrior.
You're a weekday warrior, even that. You have your tissues age as you get older, and they can't take the same kind of stress and strain you did as a youth. So
you tell me not to exercise?
Oh, no, exercise is great for you. You need to do that. That'll keep you mobile on into the many years ahead in your life when you'll be able to be functional, and it's just definitely the thing to do.
And then it's drug time. That's what we're talking to you about.
Well, hopefully it's avoidance of the drugs. And you can maintain good health if you exercise, have a good nutrition, and take care of your body.
Well, the good news is I was not on that PED list today like A-Rod, so that's all
Very
good.
good.
But maybe one day I may have to get there. I kid because I love Dr. Jeff Cannella joining me. I love his website. It's spacecitypain.com. We'll talk a little bit more about that. You're a triple board certified expert. Triple. That's pretty good, man. That's just triple in pain medicine. I know there's a lot of our listeners out there who do suffer from the acute or chronic pain, but there's also some confusion about pain medicine. So what exactly is it? What types of patients do you treat at Space City Pain?
Okay. Well, first of all, I'd like to thank you for having me on your show. Pain syndromes are epidemic in the United States, and they include both acute and chronic presentations. My practice focuses primarily on chronic pain. Any condition which persists for 3 months or longer is chronic pain. If it's shorter than that, it's going to be acute pain. Most of the acute pain syndromes will resolve on their own with minimal treatment needed. But pain medicine is a specialty that deals with pain syndromes that cannot be effectively managed by your primary care physician, a family practice physician, or a neurologist. Often, the patients are co-managed with neurosurgical and orthopedic colleagues. The pain field covers a lot of ground. You've got back pain, neck pain, joint pain, pain of nerve origin, pain that comes from damaged nerves from diabetes, shingles, complex regional pain syndrome. You have people with migraine headaches, musculoskeletal pain. We take all of those people and are well equipped to treat all of them.
Where's T-Pain fit in there?
T-Pain?
T-Pain's in the house. You talk about a lot of the advances today in pain management, though. And, I work out on the Southwest. I have a wonderful gym complex. It's called Plex. They have an on-site trainer. A lot of the athletes, current athletes trying to get into the NFL, and I see them stretching. And these are young kids, too. I mean, these are the 19, 20, 20-year-old kids who are getting ready to go to the NFL. But I'm also seeing the real professional athletes. A lot of the Astros, the Dynamo work out there, and they're probably in their mid-30s or so, and they work their bodies hard. So I see different treatments going on, and there's a number of different new techniques. There's PRP therapy, there's stern cell therapy, and a few others. Can you describe, kind of break down some of these?
Sure. There are advances in pain medicine occurring on a daily basis, with new discoveries in research medicine finding their way into the mainstream practice of medicine very quickly. The techniques you just mentioned are cutting-edge therapies designed to address the most difficult pain syndromes that are seen by pain medicine specialists. My practice employs all of these high-tech treatments to get the most functional restoration possible and deliver the highest quality of life possible for my patients. The therapies used will be based on specific conditions, and not all of them are available or applicable to every patient. But I want to tell you about shingles, because that's a very important thing. This is caused by the same virus responsible for chickenpox.
Mm-hmm.
The virus remains in your body and can be reactivated at some point after the initial infection. It's possible to develop a very painful chronic condition after a shingles outbreak, so it's a medical emergency should you have shingles. you need to see a pain specialist. Most of the time, a trip to your primary care or the ER physician will inadequately treat the infection. The infection itself will go away within days, even without any treatment, but nerve damage that it causes will last a lifetime. So anyway, back to advances in pain therapy. Some of the most exciting advances relate to regenerative medicine. You mentioned PRP, which is platelet-rich plasma, and also stem cell therapy. Each of them involve specific cells of your body which are concentrated and targeted in a specific area to regenerate tissue, such as tendons or ligaments. Also, in areas where you may have more damage than just normal medicine can handle, and you might be faced with a joint replacement like a knee or hip, stem cells and regenerative medicine may cause you to have not have to go through that procedure. It may repair itself.
Jeff Cannella joining me. He is a doctor. He is advances at triple board certified, let me add, spacecitypain.com. I want to talk first steps. How do you treat a patient? Someone comes in, it's like, okay, I got a shoulder here. And you just went through a number of different procedures. What's the first step you do in treating someone for suffering from pain?
Okay, well, the first step is for them to get it to my office. And in order for them to do that, usually they'll have to get a referral from their own doctor. And many times their own physician will be happy and relieved to have assistance in treating chronic pain syndromes. The chronic pain patient can be very frustrating for most physicians because it can exceed the scope of their particular area of expertise. When you do find the board certified pain specialist, it's imperative that you do some research to make sure that they are board certified. There are certifying bodies that make sure that the person practicing that particular medicine is competent and will give you a good health care. A board certifying pain practice should not be confused with pill mills, where it's a cash pay and you get prescription medication, but not necessarily a diagnosis and not necessarily treatment for your condition. There is an entity in Texas called the Texas Pain Society, and it's at www.texaspain.org, and they're a great resource for people trying to locate either a pain specialist in the city or anywhere in the state of Texas. And these are people who have shown competency in the field. Once you get an appointment, like for example, if you came to my office, you'd get evaluated thoroughly, you have a history taken, you have a physical exam performed, you have a treatment plan outlined for you, and then we'll go from there. And whatever it takes to get you better or maximize your potential, that will happen.
Real quickly, about 30 seconds. Space City Pain, very big practice. You got some partners, Dr. Joe Alvarez, Dr. Ed Garcia. Do you all specialize in the same types of pain medicine? And more importantly, where are your clients located?
Okay, our clients are located in all areas in South Houston area, Baytown, Dayton, South Houston, Galveston, the entire area. We'll have all three of us are board certified. Between the three of us, we have over 50 years of experience in pain medicine. Our offices are in Webster in the Clear Lake, NASA area, hence the name Space City Pain, and also in Baytown. I
like it. All right, I'm going to give out your website one more time. It's spacecitypain.com, 281-338-4443. If you've got the pain, I know who can help it. It is Dr. Jeffrey Cannella, part of Altus. We appreciate him coming in with the Altus health update that we do.